Hey, good day. This is Jim Blythe with the Veterans Impact Show. My co host and partner, Cedric White, is tied up helping families work together and be together. I'm here for you today, and we have a very, very, very special program about women's health. So here we go in just a second. This is the Veterans Impact Show. Stay with us. We're on board. You be on board now. Welcome to the Veterans Impact Show, where our motto is Charlie Mike. Continue the mission. I'm your host, Jim Blythe, U.S. Navy Vietnam veteran and certified senior advisor. Join me as we feature veterans who continue the mission of leadership and commitment in our communities after serving our great nation. Why, you never know who you're going to meet or where we're going to go. So welcome aboard. What a great day, and I've got a great program in store for you. If you're a lady veteran, pay attention. Share this with other lady veterans. I'd like to introduce to you Juli McNeil. Excuse me, Julie. Welcome aboard, Julie.
Thank you, Jim. I appreciate you having me today.
Hey, I was fired up when I watched a webinar and saw information about how many women are now served by the VA and how much that has grown over a relatively short period of time. Because a lot of people, especially ladies, who maybe are veterans, maybe they're active duty military, or maybe they're mothers of children that are wanting to go in the military, don't know all of the benefits to women that are now available in the VA healthcare system. So, Julie, tell us a little bit about yourself and how long you've been with the VA a long time.
Yes. So my role is as the Special Populations Program Manager with our network office which is in VISN 17, which covers all of Texas except for Houston. And the programs I cover are women's health, the Intimate Partner Violence Assistance Program, and LGBTQ plus health. So I have been at the network office for a little over 10 years, and I've been with the VA for over 31 years. So prior to coming to the network office, I've worked at various healthcare systems and worked directly with veterans. And directly prior to this job, I was a suicide prevention program manager at a VA in Oklahoma. So, but we have seen a huge growth in the number of our women veterans over the years. Of course, more have served since the OEF, OIF, OND timeframe. And if you're not aware, if viewers are not aware, Texas has the largest number of women veterans in the nation, and we continue to grow and expect up to 43% increase through 2029. So,
Really, what do you attribute that to? Other than I grew up in the great state of Texas, I really would prefer not to live anywhere else. But what's bringing the ladies here? Is it the jobs? Is it camaraderie? Is it because we are now the largest veteran populated state in the nation, period? And that's great to hear. We are attracting so many wonderful ladies.
Yeah, so probably for the last at least 8 or 9 years that I've been at the VISN, we have been the number one state for the number of women veterans. And a lot of that I think is contributed to women that are already here, but also as you know, the financial situation has shifted a lot. We've got a lot of people moving in from the coastal cities as well. And I think Texas, it offers a lot of great services to our women veterans, both in the VA healthcare system, but also the Texas Veterans Commission, which we partner with on a lot of things. They're a very strong organization and offer a lot to our veterans.
One of the new commissioners for the Texas Veterans Commission is a dear friend of mine, Chuck Wright. He and I started this program in 2015, and he's gone on to do some really great things. And I've gone on to have a lot of fun. He's on all the time. Within what we're talking about of veteran services, a lot of women I have talked to over the years don't really know what all you guys offer. They kind of shy away from it, saying that's a men's club. Not anymore. You guys offer a wide, all of the female services that women need, correct?
Exactly. Yes. We offer comprehensive care for our women. Ideally, that's starting in enrollment with a primary care provider with one of our women's health designated primary care providers. You're going to get your routine preventative screenings, gender specific care like breast and cervical cancer screenings, of course, cardiovascular assessment related to women's health, and mental health care. Everything starts with your in primary care with your primary care provider, and they'll refer you out to services that you might need under specialty care. We offer gynecology, and also care really from reproductive health age on up to geriatrics for women. There's some specialized programs for rehab and for whole health, uh, mental health, you name it. We cover all those services for women.
I think this is so important because women, I mean, I went aboard the USS Truman several years ago with a media deal. And having been on aircraft carriers in Vietnam, Julie, I was shocked at the number of women that were working on the flight deck. And I'm like, what? For an old sailor way back then, women did not go on aircraft carriers, much less any combat ship. Now they're an integrated part of the system and part of the team, and they're doing a whale of a job. So they deserve everything they need. The other part of that, you were talking about women's health, maternity. That's a big thing that you guys do as well, isn't it?
Oh, yes, yes. So we have offered maternity care services for women for quite some time now, but recently in the past year, there has been an expansion of benefits due to the need that we see our women veterans face, and actually civilian women in some of the comorbidities, the issues that women face, and challenges with pregnancy, and keeping them at their most healthy throughout their pregnancy. So we have maternity care coordinators at each of our sites. Some sites have several because we have a large population of maternity care patients as well. And their role is to ensure that they get into care in the community with OB-GYN provider. And for eligible veterans, the VA will pay for that care, and up to 7 days of care for the newborn, which hopefully that will get changed soon to up to 30 days. So we're waiting on that to pass, and hopefully that will be soon. And the maternity care coordinator's role, which can be a nurse or a social worker or a team that's working with that patient to ensure they are getting all the health care they need during that time. If they're having any um, stress or mental health issues, they're there to assist them with that as well. We know postpartum can be a big factor for our women, and we have services for that. And so we're there just to provide those wraparound services for the women during that time.
Now, Julie, what if you have a special needs child that's born? What if you have some real serious problems? Do they send that out? I know the Dallas VA partners with UT Southwestern, which has a huge program in that with the was it Cook's Children's Medical Center partnered up. So you guys partner up with them when you run into a problem, correct?
Well, anything that maybe VA doesn't have as a service that there is a need for a veteran, then we would look at community care or maybe at another VA to provide that care, all depending on what it is. But for newborn care, currently the VA only covers up to 7 days from the
Okay.
birth. So under the 30 days, I guess we'll need to see what all that would entail. But anything that VA uh, would not cover if the veteran is not eligible or a veteran's child, then social workers in your primary care clinics and other specialty programs are there to help find resources for them in the community.
Well, that's great to know. And it's great if you've got a daughter and she says, gee, Dad, Mom, I want to go in the Navy. I want to go in the Army. I want to go in the Air Force and aim high. There are programs to take care of them after service that we didn't have, what, Julie, 20 years ago? You
Mhm.
started 30 years ago. These programs didn't exist 30 years ago.
Right, exactly. You know, when I started my career in the VA, I started as an inpatient social worker at the Dallas VA and maybe only saw a handful of women then. And now, you know, women are coming left and right, and we want to continue to see them come into our medical centers. And some of the things that DOD is doing and VA has been doing is ensuring that women, before they leave service, are aware of their benefits and trying to get the word out to them about that, how to get enrolled. And one of the things that is important for our women to know, if you don't know who to contact to get enrolled, is to call the National Women Veterans Call Center. And they will link you up with your local Women Veterans Program Manager who will be happy to walk you through those steps. And that number is 1-855 VA Women. So that's also 1-855-8296-636. So it's a great resource and a for an initial step or otherwise to get someone connected into VA services.
Hey, Julie, we just had a lady, Paula, and Paula, thank you for coming on board. Make a statement. Need more POT specialists because a lot of toxic veterans end up with this and fibromyalgia. You were talking about that before we started the program
Mm-hmm.
about the importance of the PACT Act and how women need to be screened for toxic poisoning. Let's go into that before we have to take a break in a minute or two, because we want to come back to that again and go into a little more detail. So again, how can women get signed up for the PACT Act and this be able to help them?
Great. Yes, great information. So if they're already enrolled, they can ask their local primary care provider or team. If they're not enrolled, again, that the best number I can give is that Women Veterans Call Center that will link them up with their local people to get them signed up. And so any woman veteran that was deployed into one of those areas where they may have been exposed, they need to have an assessment. And part of that assessment, which is under the Service Act, which some may or may not have heard of, has to do with breast cancer screening. So all women start their breast cancer screening usually at the age of 40. And if you have other risk factors, say you have a family history of breast cancer or some other risk factors that make you at a higher risk that may warrant a mammogram sooner than the age of 40, well, that's what our VA providers are going to do. They're going to make that assessment and have that conversation with the woman veteran. And then, if warranted, they will set them up with a mammogram screening. And let me just give you a great story that I'd like to share.
Oh,
If there's,
love it.
yeah, so at one of our VAs, actually at the Dallas VA, there was a woman veteran that had never been enrolled in VA care. She called and spoke with a women veterans program manager, said they found breast cancer in the private sector, and she wanted to get VA care. They expeditiously got her in with a women's health primary care provider, got her enrolled. She had some follow-up tests and had a breast biopsy and had breast cancer treatment and also was referred for VA benefits. So it's for a very, unfortunate situation. That process worked very fast to get that veteran in for that care.
That is great to know. And
Yeah.
by the way, our friend Paula, who's chiming in, and if you're joining us on social media, you can see her notes. She's a Marine. Let me tell you something. Many of my close friends are Marine. The guy that I started this program with, Chuck Wright, Texas Veterans Commission, a Marine. So, Paula, thank you. And pass this information on.
Yes.
Share this with other people. Um, and if you're not a member of the Marine Corps League, you need to be. And you can meet Chuck Wright. which is an experience. And doing this again, let's go back because you were mentioning, and I'm going to ask you to be repetitive, the Service Act, which most people haven't heard of that. So
Yes,
again, let's make sure people understand what they need to do. Okay?
yes. So the Service Act is just an extension of the PACT Act. So all veterans who may have been exposed to some toxic exposure in the service in one of the deployed areas that um, uh, where that may have occurred, they need to contact either their primary care provider, or for the women veterans, I would highly recommend calling the National Women Veterans Call Center. And that number again is 1-855 VA Women, or in other words, 1-855 82 96 636. And they will link them up with any resources they need. And the Women Veteran Program Manager, which every site in the nation has one, can walk that veteran through the process to get an appointment for screening. And the Service Act is specifically related to breast cancer risk. So while there's no current research right now that shows that exposures leads to breast cancer, we need more information. And so this is one way that the VA is doing their due diligence to take care of our women, is assessing their breast cancer risk based on other family history and exposure, and determining if they need a mammogram before the age of 40 years old. And if that is the case, they will set them up with an appointment. And so it's very important to get our mammograms when we're due. But for the Service Act, we want to make sure our women know that they need to come in and have that assessment and then determine what their needs are from there.
Now, according to Paula, not all VAs are as proactive as our Dallas VA. And thank you, Dallas VA, for being so proactive. So they can go check in to their VA and find out what's available to them, correct? If you're in
Yeah.
some other place.
Yes. So your patient advocates are a good source. Of course, if they're primary care providers, your social work service, and again, your women veteran program managers are your key points of contact at each site. Um,
One of
so
the things that I have been told a lot about is the community care. You guys can refer them out. If it's not in that VA locally for some reason, and I don't know about many of the other VAs around this nation, then you can check and see if you can get a referral to community care and get what you need there. So tell you what, let's do. Julie, let's take a break for a second to hear from our partners, and then we'll be right back to continue this conversation about women's health, women's well-being, and I think some of the other things that we want to talk about, the mental health part of this, which you have so much experience in. So this is Jim Blythe. I'm here for you. You pass this information on to help more women veterans. We'll be right back. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Hey, guys and gals, this is Jim Blythe, Veterans Impact Show. A little quick note. My NMLS number is 311548. My corporate one is 2289. And I work for Fairway. And Fairway Independent Mortgage is the largest non-bank mortgage company in the nation. I specialize in elder care. I'm a certified senior advisor. We have a great program coming up right now, though, to provide reverse mortgage discounts and benefits to people who are veterans. So if you're over the age of 62, you want to know more about that, contact me. I'll get you the information. I operate in the 7 states down here around Texas, but I can hook you up with somebody across the nation. This is a great program, not for everybody, but it can help, and it can help to pay for a lot of things that are badly needed when it comes to health. Now, Julie, your experience in suicide prevention and mental health, and as a caseworker, when I read your resume, I was like, wow, That's great. I mean, you are really on top of it. Let's talk a little bit about women's health, because that's a wholly different deal from men's mental health. Women have PTS, and I almost want to make a joke because my wife had 3 children, and I think she had PTS from just the children, much less she never went into combat and didn't serve in the military. But there are a lot of unique things with women's mental health, PTS, and moral injury. Can you elaborate a little bit on that and the care that you have for that?
Yes, yes. So we know that women compared to our civilian population, that they do have some additional struggles with mental health. And of course, it could be related to military sexual trauma or combat, post traumatic stress, or other issues. One of what I mentioned before is could be postpartum depression, which throughout the country we need to keep an eye on, and we have services for women related to that. Um, we have strong mental health departments at all of our sites, and a newer role that people may not have heard about is our women's mental health champions. So every VA has one or more women's mental health champion that is an expert in women's mental health, and they then share that information, resources, and train other providers to make sure that they are up to date on any women's mental health issues. They partner with our suicide prevention teams. Of course, as many of you may know, we have our evidence-based therapies across our sites for post-traumatic stress, whether it's combat related or military sexual trauma. We have eating disorder teams, and basic depression, anxiety, you name it, we provide that care for mental health. And unique to women veterans needs, what some things that we're trying to do to look at what other services we might need to expand upon is getting that feedback from our women veterans. And past legislation has mandated that every VA have quarterly focus groups each year and a minimum of 2 women veteran forums or town halls, so we can get that feedback of what their needs are. So this is another way where you can connect with your women veterans program manager, find out when those are, and to get you plugged in to get that feedback from you. So also perimenopause and menopause, sometimes we don't hear so much about that, but it's another end stage of reproductive health care that many women see some things happening to them, have some issues, maybe have additional stress or weight gain, hormone levels that need to be looked at. And so we're looking at a team approach to address that with our women veterans, which can involve both the primary care side, whole health, mental health, really treating the woman as a whole person. So there's an array of services there for our women. And we have seen, as people are aware, I think, some increase in suicides among veterans in general. We know that veterans that partake in VA care have a lower risk. And in the past, we have seen women in the military or have been in the military have a higher risk of suicide risk. And so our teams are aware of that and there to assist women and their families to work through what those issues might be and help them with any mental health care need they might have. And that can include basic outpatient therapy, group therapy, residential treatment, and of course, acute behavioral health needs where someone might be at an imminent risk that comes in maybe through one of our emergency departments that needs care.
That's really important. But I want to make an observation, because when we talk about these things in veterans, and especially women veterans, we give the impression that a lot of bad things happen to people in the military. I got to tell you, Julie, from my research, this nation has an epidemic of suicide, especially in teenagers. It's across the board. We have these problems that are many times for our veterans, but they're in the nation. We're a micro part of the nation, you know. And so
Exactly.
here we have the VA that focuses on it. And quite frankly, I'm not so sure the civilian hospitals and populations do the whole health and really look at the whole person and really treat the whole person and are helping them to the same level that the VA is focused on it. That's just my observation. How about yours?
Yes, I got involved in the suicide prevention program when it first started, and it really had there was things being done in VA before, but it's really grown and expanded even since I've been out of that particular role in the past 10 years. And suicide, the last I checked, is still the 10th leading cause of death in the nation. That's not just
Yeah,
a veteran statistic, that's a
it,
nationwide
it's
statistic.
a nationwide statistic. All right, we're going to
Yes.
take a break to hear from our partners, and we'll be back with Julie talking about women and veterans' health. That's really, really important. And there's some other aspects of what her resume said that I'd kind of like to dig into. So this is Jim Blythe. You're here with Veterans Impact Show. Thank you to Fairway Independent Mortgage, and we'll be right back. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, how about that? We're covering a lot, and I got to tell you, this is really, really important. Why? I have been to so many veterans events, talked to so many women veterans who tell me kind of horror stories about, well, so many years ago, they didn't have gynecologists, they didn't have women's health in the VA. You've got it now, and you've got it with absolutely sterling quality people like Juli McNeil with VISN 17. Julie, again, let's give out that phone number for the Service Act that you were talking about to let people know. I want to let people know because people come in and out of a program. There's help for them out there. Please
Yes.
tell us that again.
Yes, whether it's a service act or a women veteran needs to connect with any healthcare program or need benefits or information about VA, the National Women Veterans Call Center is where they need to call, and that number is 1-855 VA Women, also known as 1-855-8296-636. And that you can reach actually women answer that phone line at the National Women Veterans Call Center. It is from 8 to 10 p.m. Eastern Time, Monday through Friday, and Saturdays 8 to 6:30 p.m. Eastern Time. So it's an information and resource line. They will get you linked up to your local facility women veteran program manager, whether it's here in Texas or California, New York, wherever the veteran may reside.
Now, Julie, let's touch on a little more difficult subject because you mentioned this before, the LGBT community. A lot of times I would think a woman who's maybe a member of that community would be very, very reluctant to go to VA healthcare. But in your discussion and in your bio, that's an area that you also are over and you work with. Can you tell us a little bit about that and how women who have that persuasion shouldn't be worried? As a matter of fact, let me tell you, I have two relatives that are LGBT and I love them both. So I look at this as just another human being, another child of God. There's no difference. And they need just as much help, sometimes more than some of the rest of us.
Yes, thank you for bringing that up. Yes, one of the programs that I cover is the LGBTQ plus health program in the VA. And it is there to ensure we're providing health equity across all of our veterans that fit into that category, and make sure that they get the services they've earned. And at each facility, there is an LGBTQ plus veteran care coordinator. Some sites may have two, and they're there to advocate, to help with resource referral. They also do a lot of education and training with staff in the community, and involved in outreach and awareness events. And so if a veteran needs that service, or any services, or has any issues, they can reach out to their LGBTQ plus veteran care coordinator. And if you look at any of the VA websites, you should be able to go into that page where it will list the person's name and phone number. And certainly, folks can reach me at the VISN office if they're not sure who to go to. Also, the patient advocates at the facility should have that information.
Julie,
So,
do you want to give out your email address so people could contact you?
sure. My email is juli.mcneil, MCNEIL, @va.gov.
All
And
right,
just
say that again.
note, it's juli.mcneil, MCNEIL, @va.gov. And we want to make sure that your privacy is adhered to. So if you email me, I would suggest don't put a lot of personal information in there. If you're just looking for a resource, or want me to call you back to make sure we connect you with what you need, just drop me a little note, and be happy to reach out to you.
Oh, that's reassuring to know, because a lot of times people, and I know a lot of men veterans say, "Oh, gee, I don't want to be in the VA, blah, 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 blah." And I keep telling them, this is not your father's VA. This is not the VA of 20 years ago. This is not the VA of 10 years ago. We have really made huge improvements. Wouldn't you say? You've been at 30 years.
Oh, yes, yes. And something I haven't mentioned yet is back in 2021, Congress has been able to support VA in expanding women's health care through special purpose funding. And so we have been able to apply for and get funding to have additional staff, equipment, supplies, programming for our women veterans. And in our VISN, we've had over 60 new staff that are dedicated to serving women veterans. Some of our sites have been able to get new mammogram equipment, 3D mammogram equipment, a range of things to help meet those gaps and needs of our women veterans. And we're about ready to see our next round of applications later this month. So all of our sites will be assessing their needs to see what we need to continue to serve our women, and again, expand services.
So if you're a lady and you are a veteran and you're not signed up for the PACT Act and you're not signed up for VA healthcare, I got to tell you, what are you waiting on? That simple. What are you waiting for? It's going to help you. Now, let's go to another sensitive subject. One of the things that we hear of is sexual trauma in the military. Well, Julie, I don't think we have any more sexual trauma in the military than we do sexual trauma in the civilian world. I mean, I talked to a lot of ladies over the years, and I started to write a book, and I decided not to, who had all kinds of problems as children, child abuse, and various things. And there's a lot of sexual trauma in this nation as a whole. How is the VA leading the way in helping women who have suffered sexual trauma?
Yes, good question. So for quite some time now, the VA has implemented their military sexual trauma program. There is at least one military sexual trauma coordinator at each facility. and they are the point of contact for people who may have questions or need services, and need some help related in that area. And that's for men or women, any gender. And the additional thing that has, or additional programming that kind of supports that, which they're interrelated, is the Intimate Partner Violence Assistance Program, which is another program that I oversee. And we have those program coordinators at each site as well. And so whether it's an intimate partner violence, it may or may not be military sexual trauma related, there are services for those veterans. We empower our primary care to ensure we have screening for both military sexual trauma and any relationship, health, and safety issues, as well as suicide risk and several other things. So we can identify any issues early on and ensure we get those veterans to the services they need. So we have treatment for those services. I mean, for those needs.
And that's a huge change from World War II. That's for sure. I mean, gosh, this is not your father's VA. I said it a minute ago. And this is important because, again, why? It's not only important for our veterans, our men and women who serve, but it's important for this nation because the VA leads the way. I made a statement, and Julie backed me up some time ago, that 70% of the medical professionals that practice in the United States did training at the VA. Think about that for a minute. So the innovations, the things that they do lead the way. I know I've talked to police officers in the past, and they've said, gosh, they hate to see a sexual trauma deal because it just gets all twisted. What Julie's telling us is if there is a sexual trauma, they've got a specialist to help you out. That's huge and that's important. Correct, Julie?
Yes. Yes.
So you're better off in the military than in the civilian world.
Right. So yeah, when you don't see all the range of services and disciplines and programs like you do in the VA. It's really a one-stop shop for all your healthcare needs, mental health needs, whatever it might be.
And Julie, my personal experience and the experience of many people I've talked to is it's like they start working with you and it's whole health. Peel back the onion. What have we got here? What have we got there? In the civilian world, you're going to be up on your feet and out of that hospital in 3 days or less. They're moving you through. I have heard stories about VA. They treat one thing and they're looking over here and they're seeing something else that they need to work on. And that's really true. It's a whole health program. And you're over that.
Right. So another important piece of information for people to know, again, when the veteran gets assigned to a primary care team, they get a whole team. They get the provider, the nurse, the clerk, but also the ancillary support to that are your primary care social workers, your dietitians, your behavioral health staff. They're all embedded with primary care. And so those needs can be met through in that team. And then when specialty needs arise, they're going to ensure that they get you referred out to those needs, whether it's surgery or physical therapy, or in our whole health programs. Various sites have they have different things that they may offer, but it could be yoga. Some of our sites have healthy teaching kitchens, which show veterans how to cook and eat healthy. You name it. It's a whole health approach, and to get veterans the best care that they deserve.
Well, one of the things you think about, many veterans went in when they were 17, 18, 19 years old. They didn't really have a lot of life experiences with cooking, nutrition, all that. We ate at the chow hall, or we went to the local hamburger joint, or we went to the enlisted men's club. Having these things and teaching people and helping them to really be successful, I think is a part of life that's really lacking, because I don't think the civilian world does it either to any level that I'm seeing the military. And this is so important because, again, our military, which is now a very small part of the population, but typically leads the way in all of the things that we need to do to improve this country. So by having you and having these facilities, these programs available, that's huge, Julie. That's
It,
huge, because
it,
they're not there in the civilian.
yes, we do have a lot of unique things that you do not see in the civilian sector. And just to follow back up on like the Healthy Teaching Kitchen and the MOVE programs, which is a weight management program, I had a story of a women veteran a few years ago out of the Austin area who joined a women's only MOVE group. And she came to me and said how wonderful it was. She was able to do it virtually, which is another great option for veterans. A lot of these things can be done virtually if they have trouble getting in for appointments. They can do it at the ease of their home, and it might be sitting in your car for an appointment on your lunch break. So there's ways to get you connected with these resources. But this woman had great success with the program, had lost the desired weight, and is much more healthy for it. And she just had praises to give for that program.
You know, we're talking about women's mental health and women's health, physical health, so much that I see as a certified senior advisor is men as well. I've seen men that are, terribly obese. I go into their home to talk to them, and there's an ashtray full of cigarette butts and a 32-ounce big gulp full of Coca-Cola, and they're morbidly obese. And I say, you got to change. You got to get some help and change, because you're killing yourself. You're hurting your family. All of these, sugar is a poison. Sugar is a serious poison. One of the biggest problems that we have in this nation is diabetes. And you are probably very familiar with that, of some of the people you see, and having a diet program. That's where the vast majority of diabetes comes from, is bad eating habits. Wouldn't you agree?
Yes, a lot of it definitely is that, and relearning behavior and making healthy choices. Um, Another thing that we are doing in the VA to look at health equity and something the audience may or may not have heard of is called social determinants of health. So we're looking at the background of that person. What is their family situation like, their financial situation, support situation? Are they connected with social media and have resources to the internet and information? Do they have adequate access to the healthcare? Are they living in a rural community and or have trouble with transportation? So one of the screenings the VA does is looking at housing and food insecurities. And so aside from trying to manage diabetes and weight loss, is making sure that our veterans have access to these other things, which are our basic needs. Because on our Maslow's hierarchy of needs scale, we've got to have those basic needs: housing, food, security for ourselves, for our families. And so we can then focus on other things with our healthcare. And all of our sites are also moving forward to participate in other pilot studies to delve in deeper into these social assessments, again, to looking at what other factors are involved in being able to maximize that person's potential to have a healthy, successful life.
That is it. Maximize the potential. When we come back, we're going to be wrapping up, bringing this program back into the dock, and I'm going to give you out some websites, and I'm going to give you some great advice. Go to the VA. I did. It helped change my life. I know you talked about Stephen Holt. Let me tell you, he told me some stories that it changed his life as well. This is Jim Blythe. We're going to be right back with Veterans Impact Show. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Well, Julie, we're wrapping up this, and I just want to say thank you so much. And again, go to the VA website, look for the PACT Act. It's right on the front page, right, Julie? Right on the front page.
It should be there, and we're scrolling past by other hot topics, but yes, it's usually in the forefront of the.
Okay. On va.gov, you want to go to Women Veterans Healthcare home page. It's right there at va.gov. That's Women Veterans Healthcare homepage. And then the PACT Act for your VA benefits. What if you saying, oh, Jim, I'm Vietnam veteran and I'm not that savvy? Let me tell you something. In the state of Texas, Julie knows this as well as I do, there are county veteran service officers in every county that are paid for by the Texas Veterans Commission. Those men and women are free. They have computers, they have access to records, they can get you what you need. They can help you with the paperwork. Throughout the nation, there are VA accredited reps, and I've had many people call me and say, gee, I had one lady in Richmond, Virginia call me, and I got a hold of a VA accredited rep down here that's a county service officer, James Henderson. He connected me with somebody in Richmond, Virginia, and we got that person aid and attendance pension within 2 weeks. I'm telling you, if you ask for help, if you don't ask, you're not going to get, without a doubt. And again, Julie, you've given out some great information. We've given out some websites. Again, ladies, the PACT Act is also for you. There are signs of toxic poisoning that you need to be aware of. You need to sign up for the PACT Act and get that screening. Julie told a story about a lady that did it, and come to find out she had very early stages of breast cancer, correct?
Correct. She was not enrolled in VA, got that diagnosis on the outside in the private sector, and contacted the local Women Veterans Program Manager at her site, who quickly got her enrolled, got her assigned to a primary care team, got the additional tests she needed, and biopsy done, and treatment. And that was expedited, very timely. We take those things very seriously. We have people that are here to take care of you. If I can say nothing else, I care about you. Our women veteran program managers and other staff, they're dedicated and care about you, and we want to see you get the services that you have earned. And this is not your father's VA, and if you have any problems, we're here to hear those too, and we want you to come to us so we can care for you and continue to make things better.
And Julie, give out your email address again. So if they want to correspond with you, if they want to talk to you, man, you're right there for them.
Yes.
And okay, please.
My email is Juli, Juli, no E, just Juli.McNeil, McNeil @va.gov. And also the National Women Veterans Call Center, where you can reach your local Women Veteran Program Manager wherever you're at in the nation, Texas, New York. That's 1-855 VA Women. Again, that's 1-855-82-96636. If you email me, please keep in mind I want to ensure we keep your information private. So via email is not a private way to give me all kinds of details about your situation, but give me a little line or two of what you need, and I can reach out to you, give you a call, and make sure we get you set up with the correct people to assist with your care.
Yeah, and there's a network of professionals like you across the nation. I want to say a special thank you to Joe, who chimes in from Jacksonville, Florida. And Paula, I don't know where you're from, but man, I'm looking forward to talking to you. And I bet you're going to email Julie as well. What's great that we've had some great people. Please get out and share this. You need to let people know this, as we both have said, this is not your grandfather's VA. we're here to help. The VA is here to help, and they're here to end isolation. They're here to reduce and end suicide and mental health problems. They're taking a proactive stance. This is a great opportunity for you. And Julie, what would you say to the mother of a young lady who says, gee, my daughter wants to go into the military? What would you say to her, Julie?
I say that's great. Women are great leaders, and it would be a great experience for your daughter. And when they decide to get out of the military, the VA is here to care for them.
Absolutely. We now have, I believe, a lady admiral who's running a aircraft carrier, or lady captain running an aircraft carrier. Man, my day, that would have never been heard of. And I think that's fantastic, because I got to tell you, women many times are better drivers than us men. My wife would attest to that.
Yeah.
Trust me. And Julie, this is so important, and we're so thankful for you to have been on board. Again, contact Julie. She's given out her email. Diane put that up, julie.mcneil@va.gov. And I got to tell you, it's so important to know that these things are available to you. Don't sit back at home and be afraid. Get out there and make a difference with your health, and then help make a difference with another person's health who is a veteran, because we all believe leave no veterans behind. Julie, I like to close with a prayer and say, Lord God, King of the universe, we are so eternally grateful for our veterans, for people like Julie in the VA healthcare system, and people in the military peer network, and so many more who work to serve and help our veterans. God, we thank you for the hedge of protection around our active duty military and first responders, those who run into the fire instead away from it. Lord God, we thank you for our veterans, as I said, who lead the way in this nation and help this nation come back together to be one nation under God, indivisible, with liberty and justice for all. We thank you for this in your holy name. Amen. Julie, thank you for being on board. I look forward to personally meeting you and shaking your hand someday.
Yes, I look forward to that as well. Thank you so much for having me and helping us get the word out for